I'm Dr. Jordan Harris, LMFTS, LPCS, and I help therapists do two things: to get unstuck with the hardest cases and to increase their retention. And I do this by teaching therapists four foundational skills. These four skills, if you think of your model as the car, these four skills are the gas that makes your model run. And they are therapist persuasiveness, the client's level of motivation, reading clients' body language, and then helping clients access their inner world. And today, we're looking at a few different skills in the work of Dr. Tori Olds, as she works with a female college student. A quick note as we dive into this video. This is not an actual client. This is Tori working with her sister for a demo for training purposes. And she was gracious enough to let me borrow the tape and break it down all along these four processes. Okay. So let's dive in.
Hey, Stephanie.
Hi.
So just take a second as we start just to check in with yourself and see where you are today.
Tired.
How do you know that tired's the right word?
I just had so many tests this week, like finals week, and I just feel like ugh.
Oh, so just notice the ugh and just kind of see even as you do that. We're just going to put awareness there, like how you feel it in your body.
I don't know what I feel in my body.
How do you, so yeah, is it kind of like a disconnected, does it feel like in a nice settled way there's not much going on, or does it feel disconnected, or?
I don't know. Whenever you tell me about like checking with my body, I just don't feel much in my body.
Okay.
I just know I'm tired because it's been such a busy week and there's been like a lot going on. And it was just exhausting.
But there's like not.
So I love this. I love this. I love it. I love it. I love it because this is so real. You go to some training and you learn some technique, and then you go sit down with your own clients, and they're like, "What are you talking about?" Right? You go to somatic experiencing, you go to EMDR, you go to hypnosis, you go to trauma focused CBT, whatever your model is, and you learn this technique. And when you watch the trainer do it, and they show some tape where they do a live demo, and it's like, boom, magic. Just do this, and you'll fix all your clients. And then you actually go back to your own clients, and they're like, "What are you talking about? What are you talking about?" So this is going to be a great clip to watch because it's really going to show us how do you work with a client when your model, your intervention doesn't make any sense to them and they're not connected to it at all.
A lot of feeling with it. It's just kind of like more an image or a knowing. Well, would you like me to explain a little why I ask about the body piece? Because it sounds like it's a little confusing for you or something. Like, what's up with why are we even care? Okay. So,
So Tori's going to go into an explanation. Now, there's two things we're going to talk about today, and this is going to be kind of complicated because there's two of them, and I'm going to try to make this as simple as possible. Um, there's sometimes at this point in the therapy, clients don't do what you ask them to do because they aren't motivated to do it. And our response then sometimes can be to help motivate them. And that process of motivating your clients is what, in the research that I'm aware of and that I teach in my trainings, is called persuasion. And I don't mean like this coercive sort of forcing, pressuring persuasion. I mean, what you think of when you think of as, oh, this client needs to be motivated to make some sort of change. And one of the easiest ways to motivate your clients is to give them a persuasive rationale. And I'm highlighting this right here because what Tori is doing is not persuasion. This is more psychoeducation. This still might be helpful, but the persuasion research that I teach from basically says that you need to give your persuasive rationale after the client has had a charged experience. In this clip so far, the client has not had a charged experience, right? There's no emotional arousal. So this is more like psychoeducation, and this might still help the client in some way. And I am totally for psychoeducation, but I do want to make a very clear distinction that the persuasion, at least the research that I'm teaching from, says that after the client has had an emotionally charged experience, that is the moment to give a short rationale. Because it's basically because you're using the energy that was brought up in the emotion to sort of show the client where to go next. And if you don't, it can often fall flat. This is often why we will give clients a reason to do something and they'll go, okay, but why? But wait, this doesn't make any sense to me. You kind of need that emotional arousal for them to like really make sense. And so we're going to see what happens here. Um, but I want to point that out, okay? That for persuasion to be effective, to actually change someone's mind, it needs to come after an emotionally charged moment, which we don't have here.
Often I'll ask about what's happening in the body just because it's like often when we feel emotions, like why we even use the word feel them, it's like it's kind of a visceral, it has a sensation with it. They sort of happen in our body in a way. So if we track what's going on in our body, it's one way sort of to peek into like what's just going on in our brain, basically, like in our whole system. Is there emotion? If so, how are we reacting to it? Are we getting anxious or shut down? It's sort of like a lens to be able to kind of track you and track your feelings. That makes sense.
Yeah, but I mean, I don't mean to be resistant or anything, but how is that going to help? Because I'm still going to have the test. I'm still going to be tired.
Do you mean like if we do all this inner work and tracking?
So what do we see? The client sort of pushes back against the explanation. And this is what we would expect, right? You want to understand the person's perspective, wait for a charge moment, and then offer a short rationale. And we don't have that so far, right? Um, my sense of this tape is that maybe in this sort of demo, the therapist has had other sessions. And so there's the understanding of the person's perspective, but this is not a charge moment. And the rationale then doesn't really land, right? So that's what we would expect. There's something else that happens here. And uh, it goes back to this idea of motivation. When we think about motivation, the research that I teach from basically says that there's four phases of motivation: resistance, sustain, ambivalent, and change. And this resistance phase is usually the hardest for therapists to see in therapy. Resistance in the research that I'm working from is any time the client says no. It's any time, even a momentary disagreement, and the client goes, I don't know about that. And that's what we see here. Watch this again.
Are we getting anxious or shut down? It's sort of like a lens to be able to kind of track you and track your feelings. That makes sense.
Yeah, but I mean, I don't mean to be resistant or anything, but
See, she even says it. She even says it. I don't mean to be resistant.
how is that going to help? Because I'm still going to have the test. I'm still going to be tired.
Do you mean like if we do all this inner work and track?
So this is a moment that is very, very important because most therapists don't see this as the client being resistant. And I think for good reason. A lot of therapists don't like the word resistance because they think it means that the client is being bad or something wrong is happening. And that's not what we mean. Resistance is any moment of momentary disagreement between you and the client. And why that's important to see these moments is because how we handle these moments has a disproportionate effect on the therapy for up to at least 2 years out. And the main goal then in these moments is not to fix any problems, it's to get back in alignment with the client. And the easiest way to do that is to reflect. Okay. Let me say that all over again. I know that's a lot of information. Any moment, any even a brief moment of disagreement between you and the client and the research is coded as resistance. And the big thing for you to do then is to get back in agreement with the client. And the easiest way to do that is to simply reflect back to the client what they just said. Now, I do a whole deep dive on this in my trainings. If you are interested in coming to a training and doing a deep dive on that, click the link below, and you'll get updates on all my trainings. And I give a bunch of free trainings, so you can come to those as well. Um, so if you have any confusion, please look at those resources. But for this tape, let's see how Tori responds to this momentary disagreement between her and the client.
Yeah, but I mean, I don't mean to be resistant or anything, but how is that going to help? Because I'm still going to have the test. I'm still going to be tired
Do you
from
mean
the
like
test.
like if we do all this inner work and tracking, like still all the hard stuff on the outside doesn't fix those things?
Yeah, nothing goes away. Now I get to explore all that.
It's a good point.
You know,
It's a good point. You're not being resistant. Okay.
See, this is why it's so good, right? Because this is why I love watching Tori, because she's really a master therapist. What does she do? She reflects what the client just said.
because I'm still going to have the test. I'm still going to be tired
Do you
from
mean
the
like
test.
like if we do all this inner work and tracking, like still all the hard stuff on the outside doesn't fix those things?
Yeah, nothing goes away.
Right? That's a reflection. She just reflects back what the client just said. And that moves her back in alignment with the client. And then Tori does something actually even better than that, right? She does this thing called enthusiastic agreement,
Now I get to explore all that.
It's a good point.
You know,
It's a good point. You're not being
right? It's a good point. It makes total sense that you think that way. It's a good point. Yep. She's even laughing like, yeah, I see what you're saying.
resistant or difficult.
Right? And then she sort of affirms the client, right? She says you're not being resistant. Technically, in terms of like research, the client is, but it's not a problem, right? Resistance is like, talk about it as therapy mold. Think about your bathroom. If you use a bathroom, eventually you're going to have mold in your bathroom. You need to take out your shower or take out your bathtub and maybe replace it because there's mold. There's nothing wrong. Like you didn't use your shower wrong by turning on the water every day. It just happens. It's just a part of life that eventually you use a shower every day for 10 years. At some point you're gonna have to replace the shower. So you're gonna have mold in there, and then you clean it out, and it's fine. Totally normal. Totally fine. Um, what the problem is that when you see it, when you see the mold, and then don't address it, that's the problem. And so I think Tori's totally conveying that in her response, right? She's reflecting back with what the client just said, affirming the client, and then saying, there's nothing wrong with what you're saying. It's totally valid. That brings her and the client back in alignment, which is exactly the right thing to do when you've been misaligned. So look, that's the teaching for today. If this is interesting for you, like feel free to again go down to my newsletter. I'll click the description below and sign up for my newsletter. I'll send out more trainings like this. Otherwise, I'll see you in the next video.